So Ronan, could you explain first of all just what is morale like in the hospital at the moment?
Morale in the hospital is very, very good. We're a very well rehearsed, trained system, and also from being from a very small community, we have very hands-on management, good exchange of information, and staff all are working together, realising that they are part of the community, and the answer to this epidemic and getting through it lies in the community. So we're all pulling together, and we all have the same issues. Whether you're a doctor, nurse, pharmacist, physio, domestic assistant, healthcare worker, we're all treated with respect, good exchange of information, and we're all going to be treating our own families and friends and members of our local community. So we're in this together, and morale for that reason is high and will have to stay high. For that to do so, staff have to also realise and be aware that their local communities are behind them. That they'll throw in behind them, and that they'll come together to support healthcare workers in their daily duties. And we, as a trust and as a region, will need the local communities to come in behind our staff.
And Ronan, just in terms of testing for frontline medical staff, you're right in the firing line of this pandemic.
Absolutely, and currently the guidance is from the Public Health Agency, which is based on guidance given from NHS England, that currently we are not testing staff.
And just on the testing model itself, obviously there was a change in tact from Boris Johnson yesterday in his daily briefing. Can you explain a little bit how that change in tact makes its way down to the South West Acute Hospital and to this region?
Yeah, well, there's a very simple structure involved in dealing with major issues like this, and we've done this before in the South West Acute and in Noma Hospital several times now. If you look at G8 Summit, if you look at when we actually moved hospital, while granted they weren't the same scale as this, it was the same structures that were involved. The Public Health Agency sits on the NHS England and takes advice directly from them. They feed that into our Silver Command, and then they feed that down into our Bronze Command. And Bronze Command is an operational side of things, and Bronze Command operationalise what their direction is. So if we get a direction as a region and we're asked to operationalise that people are tested, where they're tested, how many are tested, then we will just deal with that and do that. But it's very important that we have a cohesive approach and that we follow guidelines currently.
And in terms of capacity to test and number of available tests, you don't see that as an issue moving forward?
No, there's very many ways to test for this virus and when you're positive, and that has changed again in the last couple of weeks, so we can flex up and flex down. Once we have the guidance, it's the operational side of things that has to meet that, and so far we've done that very swiftly, because we've been here, albeit in a different way, many times before. We have that experience, particularly down in the South West Acute Noma hospitals.
And in terms of people who are feeling ill at the moment, there are a set of directives out there to follow if you've got symptoms. What's your advice to people in terms of if they want to get in the car, get someone to drive them up to A&E, what would you say to them?
Don't. Follow the guidelines. Follow what are on the PHA website. 2 clicks and you'll get your answer. And then it gives quite clear guidance on how to self-isolate, who to self-isolate, and how you go about that. It's very important that the community realises when people are self-isolating that they have to be supported. Otherwise, this will not, it's not following guidance, and we may have a different outcome.
In terms of people's perception that the Republic of Ireland is following a very different tact, you mentioned earlier on in the briefing that the NHS is different to the Southern Health System, and the school systems are different and all of that. But do you understand the frustrations that people might feel?
Absolutely, and they're right to share frustration, and they're right to ask questions, because the only way they can get the answers is to ask those questions. It's very important to realise that, however, that we are a different healthcare system, we have different resources, we are a different schooling system at different times, plus the spread of the virus is a different part of the curve. It is also very important that you realise that things do change rapidly. It's changing every few days, and that we stay on top of that. It's most important for us that we can change rapidly to operationalise what the guidance is. It may well change in the future.
There has been a lot of discussion about ICU beds and equipment and things like that, and there's different graphs about where Northern Ireland stands compared to other countries. Are you confident that you're going to be able to increase capacity, maybe not to where it's needed when this reaches its height, but that you're able to increase capacity from where you are now?
Yes, we have plans afoot to change the capacity both here and in Altnagelvin. Patients who become critically ill will be staying in the South West Acute and Altnagelvin area hospitals, and we have plans and process to change how our resources are channelled. We have plans in process. We have planned to expand into and utilise all space available to us in the South West Acute and Altnagelvin area hospitals.